Every year, more than 2 million babies die out of ignorance of caregivers and lack of the needed knowledge to help save the life of babies at birth. Here in Umuahia, the Abia state capital, participants are taught the initial steps of neonatal resuscitation to save lives and give a better start to many babies who struggle to breathe at birth. The training is in collaboration with Abia State Government and State Ministry of Health. The association says the training is to decrease morbidity and mortality rate while helping mothers with the requisite knowledge needed for prenatal and postnatal care for the child, at least for a period of 1 year.
Within Nigeria, neonatal mortality is one of the highest forms of mortality of the subsegments of the population. And if you divide the commonest causes of neonatal mortality, you have asphyxia, preterm labor, and infection. And asphyxia is the one that we're trying to impact upon because it's one of the most significant.
What some people used to call birth asphyxia. These are babies that are born, they may not be breathing and people think that they are dead, but they are really not dead. They just need somebody to be there to help them breathe. So our task for the first day is to make sure that everybody that's here walks away knowing how to help every baby breathe, so every baby has a chance at life. Then tomorrow,
the state will benefit from a huge amount of pressure lifted off their neck because of the multiple surgeries and other medical consultations we do for the very poor of the society.
For Professor Rukere Ugumba, the brain drain, popularly known as the Jaba syndrome, is one of the major reasons for the training and to give back to the society.
Well, we realize that to do capacity building, we have to come back. We have to come back to train people, and then not just train people, we have to give back to society. Child and neonatal mortality is still one of the leading causes of death from even asphyxia. So to train them properly, to know what to do, can save lives.
Also, wife of Abia State Governor Priscilla Ote says her office is committed to ensuring the safety of babies at birth through regular trainings for health workers in the state.
I pledge my commitment to this helping the baby survival initiative, and I will give it all that is required to make it a success.
For the participants, the training is not just eye-opening, but a step towards better child delivery and neonatal care.
With this particular program, I think I've better acquired skills to help me look for ways to help a baby survive while not inflicting more damage or hurt to the child.
Because I learned a lot of new things, and one of the major things I learned was placenta cutting, because I've seen cases where you just bring out the baby and you make an incision, you just cut. But they thought about placenta cutting where you measure 2 cm to 5 cm just with your hand, which is much more easy.
The ANPA week would feature neurosurgeries, among others. The Association of Nigerian Physicians in the Americas has spanned over 30 years with the vision of a healthier Nigeria in a healthier world. Nora Okafor, Arise News.